Technology is rapidly evolving. Patients and healthcare providers have more tools than ever today to help track and report information that can impact their healthcare outcomes. So how are we as pharmacists going to use this information to help improve the lives of our patients? Today, I'd plan to start talking about some of the current technologies that we're using to impact our patient care in our pharmacy, and then move towards kind of the future of where I think pharmacy technology is headed to help us rethink pharmacy for the clinical community pharmacist. Whenever we start the conversation about the clinical community pharmacist and how to implement patient care services in your pharmacy, I always like to take a few steps back and look at how we've traditionally used pharmacy technology to enhance our practices and allow us to provide these care services. Every time I talk to another pharmacist or pharmacy student and start discussing how we are able to do these patient care services, we always start talking about barriers and why they're not doing it in their practices. Just about the time, the barriers that I had in my practice 10 years ago are the same ones they're having today. It starts out with not enough time to do it, not enough space to do it, not exactly sure how to implement the care. We've been able to use technology solutions over the years to address many of these barriers, and I think starting from day one is something you should do to really look at your practice and see how you can overcome those same challenges. Number one, we really focused on workflow efficiency. We wanted to make sure that our overall goal was to give our pharmacists enough time to spend with patients. That's what we are trying to do, and that's what we love to do, and that's how we get the best outcomes. So from a non-technology standpoint, we really looked at staffing issues. Were we utilizing our support staff to their best potential or 100% of their potential? Were they doing the jobs that they're trying to do, or were our pharmacists doing their jobs for them? We decided that we wanted to make sure that our pharmacists were out front with patients as much as possible, and so expanding the role of our support staff was step one for us. After expanding that support staff role, we started to look at what other technology solutions can help us improve these workflow efficiencies. Back 10 years ago, we were a fairly low volume store, and so we started out with some basic counting technology to help improve these efficiencies. But as we grew, we were able to expand into fully automated robots. We added an IVR phone system to decrease distractions so that we were spending more time with patients and less time on the phone. We were able to add barcode technology and workflow scanning throughout our workflow dispensing process to make sure that everything went as smoothly as possible, trying to get to that primary goal of pharmacist to patient contact time. After that, we basically just tried to tweak things as we grew as a pharmacy to make sure that we were able to implement these care services as our workloads expanded. So as you start looking at your practices and figuring out ways to overcome the barriers to providing patient care services, there's a few questions or areas you can focus on to help you make the right decisions in the technology you choose to go with. Number one, as I mentioned, look at your support staff and how your dispensing process works. Is it streamlined? Are you using them to the most of their ability? Are your pharmacists calling the insurance companies and taking care of things that other folk can be doing? Or are they focused more on the patient care side? Number two, where are the big log jams happening in your practice? Is it at input? Is it at dispensing? Is it at your point of sale systems? There's lots of solutions out there that can help with this. Number three, what is your volume? A lot of folks can't really support a fully functioning automated robot when you're filling 100 scripts a day. And so you need to consider that as you're looking at the different pieces of technology out there. We started out with some basic Baker cells type counting technology when we were filling 150 a day, and now we've upgraded all the way up to a fully automated robot that does everything from labeling the vial to counting the pills to capping it and sorting it by last name. We're running about 60% of all of our prescriptions through this robot now, and it's had a dramatic effect on how efficiently we can get the prescription through that process. Number four, do you have the space for the technology? This is a big one. Some pharmacies have 8,000 square feet, and no matter how big the technology is, you're going to get it in there. Other stores are small clinic pharmacies like my own, 1,300 to 1,400 square feet, and we had a lot of limitations when we looked at our technology. So considering that footprint of what goes in your store and how it can impact your pharmacy's efficiency is incredibly important to consider. And finally, last but not least, you got to look at the cost of things. Is it a good idea to really go all in with a fully automated robot when you are filling 100 scripts a day versus 300 or 400 or 500 scripts a day? Probably not. But look at the cost and look at what these companies will do for you from a rebate standpoint, from a tax incentive standpoint. There's lots of companies out there that will work with you to make these technology solutions cost effective for your practice and will have a huge impact on your efficiencies and will allow you to take better care of patients. With the introduction of Medicare Part D in the mid-2000s, pharmacists, for one of the first times ever, were finally getting paid for pharmacy care services. We called this MTM, or Medication Therapy Management. Many Part D payers were using in-house programs, which in my opinion were not very effective, but many others were reaching out to us as community pharmacists to provide the MTM cases for them through web-based applications like Marixa or Outcomes. These platforms allowed us to identify which patients qualified for MTM, allowed us to document our services, and then also receive payment from the Medicare Part D plans. These MTM cases will continue to be extremely important as the role of the clinical community pharmacist expands. Soon, pharmacists and clinicians may be rated on performance, and completion rate of these comprehensive medication reviews through the MTM platforms are going to be a part of this rating. It was very exciting once Medicare Part D came on board for this opportunity for pharmacists to get paid for their patient care services. On the other hand, there were some issues that made it difficult for many pharmacists to take advantage of these opportunities. Number one, not a whole lot of patients were qualifying for MTM cases. And once we worked with these patients, a lot of times they didn't qualify in subsequent years, so the opportunities for us to provide care to these patients was minimal. Second, Medicare Part D MTM programs really focused on just the medications. As we all know as clinical community pharmacists, when you really look at the overall healthcare picture, we're not looking at just medications, we're looking at achieving the best outcomes. Sometimes that includes increasing medication costs to keep them out of the hospital or to have the more costly long-term complications. Lastly, because there were very few opportunities for some of our pharmacists out there, they weren't always convinced they needed to invest the time and the resources to change their practices to take advantage of these opportunities. It's now more important than ever to complete our MTM cases through both the Marixa and the Outcomes platforms. The completion rate is going to be part of the 5-star ratings that CMS is pushing out that may impact how we're reimbursed and what networks we can participate in. In addition, there's more opportunities than ever to use the Marixa and the Outcomes platforms to see patients. We're not just seeing the comprehensive medication reviews and patients qualifying for those, but we're also seeing patients that are coming into the queue for adherence type programs or cost-saving opportunities. Plans are expanding these services and utilizing community pharmacists to take care of their patients. We're also finally starting to see integration of the MTM platforms into other software packages. Many of your pharmacy dispensing software systems now are linking up with Marixa and Outcomes to make it easier to identify patients that qualify for MTM. We're also seeing this integration into some of the 5-star web-based platforms that are helping us identify those patients that are negatively affecting our scores. Integration, I think, is going to be the key as we continue to rethink pharmacy for the clinical community pharmacist. In addition to the Marixa and Outcomes web-based MTM portals for Medicare Part D patients, I'm starting to see other companies pop up with really innovative ways to provide MTM portals that are kind of outside of Medicare Part D. One of those is Creative Pharmacist, which has really come up with an innovative way to not only document the care that we're providing to patients, but allow patients to upload data to their website as well. What I really like about the Creative Pharmacist folks is they provide the curriculum to our pharmacists to use for the patient education side. We've got information in the areas of diabetes, healthy weight loss, healthy heart issues, really all the MTM information that we want to teach our patients about. They've got it in a kind of a turnkey solution for us. As our pharmacists work with these patients to teach them about their disease states, we can also record data on their web-based portal. We can record their weight, their blood pressure, their blood sugars, really all the information we need to take better care of our patients. The really innovative part of this, though, is it's not just pharmacists documenting and recording this information. Patients also have a way to log into the website and record information from home. They can tell us, are they meeting their goals for the week? Are they exercising every day or as much as the pharmacist wants them to? They can record their calorie goals, their blood pressures. That way, we can actually interact with the patient when the patient is not necessarily right there in the pharmacy. We can look in there and see how they're doing. We can reach out to them by phone or by email and encourage them that basically they're doing things the right way. Another really neat thing about the Creative Pharmacist folks is the patients also have incentives to log into the website and record this data and do their check-ins. They've got recipes of the day. They have a tool called a meal mixer where they can actually take the foods that they have in their refrigerator and mix them up, and it gives them heart-healthy recipes based on what ingredients they have at home. There's an exercise mixer that helps them find new and innovative ways to get more activity and decrease calories and improve their blood sugars. So it's really a pretty comprehensive way for us not only to record data and take better care of our patients and teach them what they need to know, but also to interact with them throughout the year, not just when they're staying there in the pharmacy. This type of web-based portal is generating new revenue streams for our pharmacy. Anything from patients paying out of pocket all the way up to self-insured employers paying for smoking cessation programs for their employees. It's a tremendous opportunity for us to take better care of patients and improve the bottom line of our pharmacy. In addition, Creative Pharmacy is currently working on an app to make it even easier for patients to record data and share that with the pharmacy. This is the future that I'm talking about, using technology to find ways to better connect with our patients. Patient adherence is a huge topic in the pharmacy world today, and technology is starting to develop to help us enhance these services. I really truly believe that pharmacists are the best healthcare professional out there to help improve the adherence of our patients. They've said it for years that medication only works if patients take their meds the way they're supposed to, and pharmacists are the experts in this area. We've recently implemented NCPA's Simplify My Meds adherence program. I truly feel it is a win-win-win for all parties involved. Number one, our patients are happier. They're coming in 1 day per month versus sometimes 16, 17 times for our patients taking multiple medications. We're also able to call them before their due date, review their med list with them, and address any patient-related drug therapy problems in advance and help them achieve better outcomes. Number two, our physicians in the community are much happier. We're only having to call them once per month versus sometimes 4, 5, 6 times for these patients that are continually needing refills. And last but not least, it's been better for our practice. We're more efficient, we're able to control our inventory better, and we're taking better care of patients. As expected, technology has started to develop to help us improve these adherence functions even more. As patient adherence programs expand and pharmacists get more involved with helping patients achieve these outcomes, technology is going to be a huge part of helping us be more efficient. We quickly discovered that using a paper system was not the best way to take care of our patients. We decided to implement an iPad system to where we actually would sit down with the patients, map out all of their medications and anchor them to 1 day every month, and set a task management app to remind us when to call these patients. This worked very well for some time, but as we expanded the program, the technology was not there to keep up with it. I've been very excited to see that several different pharmacy platforms have been developed to help us continue to improve our efficiencies with addressing patient adherence and med synchronization. Many of your pharmacy software vendors are now starting to incorporate adherence tools into your everyday pharmacy software. We've seen everything from adherence thermometers, where you can quickly look and see when a patient is 60% adherent to a medication compared to someone that's 90%. That helps us identify that non-adherence and try and get them enrolled in a medication synchronization program. Other software vendors have incorporated autofill dates and med sync dates and calendars to help give you more tools out there to really help these patients take their medication regularly and improve your efficiencies. There's also several outbound calling systems that are really starting to look at addressing non-adherence. Companies like Prescribe Wellness and ATEB now have outbound calling features that will call patients that are 1 to 2 days past due dates on their chronic medications. In addition, they've implemented MedSync automation that helps you determine your best days to anchor the patient's medications and automate the call process. So instead of having a staff member calling these patients every month, they're calling it from an automated system 1 week before their due date and then again a day before their pickup. This takes a lot of the pressure off of our staff, especially on those times when your head technician is on vacation or sick at home with a kiddo. Having that automated process has really allowed us to expand this service. We're also starting to see many pharmacies that are taking adherence and med synchronization to a whole nother level. They've started to use robotics to help with adherence packaging, meaning they're putting all the patient's medications into morning doses and noon doses and evening and bedtime. So they're basically combining all the aspects of calling the patient a week before, synchronizing them to one date, and then packaging their medications in the most convenient possible way to make sure that we achieve better patient care outcomes. After robotics, there's a ton of patient care tools out there that are helping folks remember to take their medications. Everything from e-pill reminders, smart caps that have alarms on them, to apps on their iPhone that are telling folks when to go into the bathroom and open those pills. There's just tons of stuff being developed right now to help patients take their medication the best way possible. As we potentially move towards this outcomes-based payment model, Pharmacies may be rated on a star rating mechanism from different payers in the industry. These star ratings are based on medication adherence in 3 different areas, including diabetes, hypertension, and cholesterol. In addition, we'll be rated on how many of our elderly patients are taking high-risk medications, and also what our completion rates are for our MTM comprehensive medication reviews. The very first time I heard about star ratings, I was actually at an NCPA conference and going to a continuing education, and there was a technology company there called Equip. Equip was the first one that actually was able to look at our plan data and show us what our star ratings were based on actual clinical information. This is very eye-opening for me, as it was the first time I had something tangible to look at. I'd heard we were going to be rated, but I'd never known what my score was going to be. It was the first piece of technology that I really thought could help me impact these ratings and help me improve the care of our patients. So Equip was the first piece of technology that really showed me what my actual star rating was for my patient population based on a few of the plans that they were evaluating. When that first came out, though, I was still unsure exactly how to impact those scores. Several other pharmacy platforms have come up over the last several years that really help us address it. Companies like Prescribe Wellness, ATEV, and many others are starting to allow us to generate reports to really dial it down to the patient level so that we can really target the problems that are negatively affecting our 5-star ratings. These platforms allow us to sort for patients that have poor adherence, show us the patients that are taking high-risk medications, especially if they're over 65. They're also starting to integrate with the MTM platform so we can quickly identify patients that qualify our MTM so we can complete our comprehensive med reviews. In addition, there's some automated tools that help us address adherence ratings. We're now able to automatically generate phone calls for patients that are a day or 2 late on their chronic medication. We can also sort reports for patients that would benefit from a med synchronization program. We can get them enrolled, and the automated process allows our system to call them a week before their due date, a day before their due date, and also communicate in between there to make sure we're addressing any sort of adherence problem. It's really a fairly exciting time for us to really dial it down to a patient that needs our help. We can improve their outcomes and improve our star ratings all at the same time. This pharmacy technology is really helping us to help patients like we never have before. Electronic health records are something that's been talked about for a number of years in the pharmacy world. There's actually a group out there called the Electronic Health Information Technology Collaborative, or EHIT Collaborative, that put out an excellent document called the Roadmap for Pharmacy Technology Integration into U.S. Healthcare. It's a very good read for us to look at, see what our goals for getting health information records out to the pharmacies are over the next several years. So what is the problem? Why do we need these electronic healthcare records? As many of you know, our patients out there are not just seeing one healthcare provider, not one pharmacist, not one primary care physician. Sometimes they're seeing 5, 10, 15 different healthcare providers out there, and there's no coordination of care. We've also all had those patients that show up at 5 o'clock on a Friday night after they were just discharged from a hospital. They have a list of medications from the hospital discharge and a list of medications from their home medication cabinet, and no one knows exactly what they're supposed to take and what they're not supposed to take. There's no coordination of care. Another big issue is there's no electronic healthcare record out there that's easily accessible by all healthcare providers involved. We need to come up with some sort of solution to address these issues. So what's our goal with electronic healthcare records? I really think the true goal is to improve patient outcomes through a bidirectional sharing of healthcare-related information between all healthcare providers involved, really looking at a true team approach to taking care of these patients. One excellent example as to how this team approach can really affect patient care outcomes came out of a project in North Carolina. They called it the North Carolina Home Project. Pharmacists were actually giving access to up-to-date electronic health records. They could see the information before patients were put in the hospital, what was happening during their hospital stay, as well as information on which medications were given to the patient, what the plan was at discharge. In addition, they had a piece of technology that they called Care Triage. It could actually assess the risk of the patients that were being discharged from the hospital and tell the pharmacist which ones had a higher risk of being readmitted for healthcare complications. That way, the pharmacist could really focus their efforts on those patients that were higher risk for readmission and hopefully achieve better outcomes and decrease overall healthcare expenditures. Google Glasses, pretty cool stuff. Maybe not so much from a fashion standpoint, but pretty amazing the technology that's in this little device here. Kind of brings me to what I think is going to happen in the future with pharmacy. patients now have access to wearable technology. They've got smartphones, iPads, smartwatches, tablets. They can access information quicker and better than they ever have in the past. But they're also collecting more data than they ever have in the past. They're tracking how much they're walking, how much they're running, how many calories per day they're eating. There's apps out there that patients can record their blood sugar data, their blood pressure. So how are we as clinical community pharmacists going to connect with that information? Might there be a way that we could sync that up with our pharmacy platform so we can readily see that and communicate back to them, send them encouragement emails whenever they're doing the things they're supposed to do, and then also identify times that they're not hitting their goals. I think the sky's the limit how we can interact with folks, and finding ways to collect their data and communicate them in ways we've never thought of before is integral as we really start to rethink pharmacy and become better clinical community pharmacists. I believe another excellent way to really focus on communicating with your patients is considering using your social media platforms for actual patient care programs. Traditionally, we've used social media for marketing services, and I think that continues to be super important. But think about using things like YouTube and Facebook to post patient information about their health and their outcomes. We've actually used YouTube to develop several videos on best ways to check your blood sugar, or what's your blood pressure reading supposed to be, or how do you incorporate dietary changes into your everyday lifestyle. It's an excellent way for you to continue to connect with your patients when they're not in the pharmacy. You know how many times they've been through your programs, get home, and they have another question for you. Now they can log into your social media platforms, watch those videos, and communicate with you through other means of communication to get the answers that they need. We've discussed many different types of technology today, and traditionally we've always talked about a term interoperability. All these different pieces of technology had to work together and not any problems communicating with each other. But I think as we move towards truly being clinical community pharmacists, we need to get away from the term interoperability and really start talking integration. I think for us to really provide a high level of care, pharmacists won't be able to go to 19 different websites and use 14 different tools to take care of these patients. We're going to have to see some integration into common platforms to really impact the care of our patients. Just some future thoughts to think about. You know, we've talked a lot today about wearable technology and mobile apps and 5-star ratings and how do we bring this all together. And I just had a thought the other day about what if there was a pharmacy Uber, a way for patients to actually use their smart technology, their wearable apps, to locate a pharmacy that provides all the care that they're looking for. They can see which pharmacies are taking the best care of their patients. Let's take it a step further. Maybe they can send their health records in advance to the pharmacy so that when they walk in the door, we know that they're there, we know what their health conditions are, and we can better take care of those patients. I'm not sure if that will ever happen, but it's a fun idea to think about. As the role of the clinical community pharmacist continues to evolve, we'll need to embrace and integrate pharmacy technology into our daily operations. When I try and rethink pharmacy, I imagine a time where all healthcare providers involved in the care of a patient will have access to their healthcare information on a common platform, allowing us to immediately impact the outcomes of that patient's care. Who knows if we'll ever truly see this complete integration of information, but I do know that technology will be a driving force behind making this a reality. Thank you for joining me today on the technology discussion. I'll look forward to seeing you at the next NCPA conference.